Hi, everyone. Welcome to the next show. We are going to talk about statin side effects, of which there are many side effects and adverse reactions to one of the most commonly prescribed medications. And it's fair to say that none of us are fans of statins. We will save the discussion about statin efficacy for another time. And for anyone who does enjoy our discussions, please check in the links down below, our own unique separate channel where we have a lot of other exclusive discussions. Okay, let's get going then. Statin side effects. Why don't we start off with generalized weakness and issues with muscles?
That's a really big topic to talk about in statins, which are probably one of the most prescribed medications, at least in the United States. And often people come to see me, and I'm a cardiologist, and so obviously people expect me to treat their cholesterol. And I can't tell you how many people I've diagnosed over the years with muscle weakness that's been attributed to age. And a lot of times I've asked patients, has anyone ever tried you off a statin before? And they've been to multiple other doctors and had all this testing. And it turns out that actually it wasn't anything underlying in the patient. It was a medication side effect.
Yeah, certainly muscle weakness, but it's not just weakness, it's often pretty severe pain. And I mean, it depends on the statin and the dose, but I mean, the pain can be very impressive. And not just the muscles, but the tendons as well. You can see, it can be to the point where it's fairly debilitating and you end up having to take them off of the medication for that. And it can be very impressive.
Yeah, and I've seen this side effect in many people. And of course, as I said, we'll have this whole discussion another time about the evidence behind statins. But the amount of people that I've seen who are on a statin medication and they'll report after a few weeks, they're just incredibly weak. They got muscle aches as well. And yeah, we often end up stopping the medication. Do you want to talk a little bit more, gentlemen, about the mechanisms involved? How do statins cause these issues with muscles?
Sure. I mean, what statins essentially do is causing a deficiency of coenzyme Q10 in your body. All right. And coenzyme Q10, if you can kind of think of it as like the spark plug for the cells that form energy in your muscles. So if you're taking away that spark plug or it's not working right, your cells are not going to be able to produce energy for the muscle cells. And what does that lead to? The most common side effects of statins: muscle weakness, muscle aches, large muscle groups. People think it's like a kind of a Charlie horse feel, fatigue, cramping.
Yeah, absolutely. Coenzyme Q10, that's the key deficient factor there potentially with statins. And how about certain statins that I'm not a fan of most statins out there, to put it mildly, but are there any statins which are better than others? I've heard some evidence that some of the older statins like pravastatin potentially cause less issues in people. Have you heard the same things?
Well, I think that's a standard practice. A lot of people are probably put on the more common statins first, like rosuvastatin, atorvastatin, simvastatin, which are probably more the standard. And those people who get muscle aches really are tried on lower doses of these weaker statins. They're metabolized a little bit differently in the body. This is probably a lot of information to go through, but pravastatin, lovastatin, pitavastatin are all, weaker statins metabolize better, supposedly tolerate them better, but that's not always the case. I mean, the final common pathway a lot of this is coenzyme, Q10 deficiency.
Exactly. Yeah.
I found that you're right. I mean, sometimes you can try them on a different type of statin, like pravastatin. The problem I have is usually if somebody's having significant side effects, muscle weakness, muscle pain to the medication, it is very rare I'm going to find any statin that works. No matter which one you go to, they're almost always going to develop the symptoms. Yes, every now and then you'll find somebody who's able to tolerate one as opposed to the other, but that's pretty rare in my practice. I don't know how you guys.
Well, and I'll be realistic for you. I mean, as a cardiologist, there is obviously a lot of pressure for cardiologists to prescribe statins, which I really, dislike. But if you think of yourself as a patient who you've been on a medication that's maybe you've been having extreme debilitating muscle cramps. People just thought it was age-related, arthritis, muscle fatigue, all the listed side effects. And so you're taking off that medication only to be put on the same class of medications for another one. that's just because we just don't think that, well, maybe this person is better treated with lifestyle changes and not just, going straight to another statin. Is there anything else? Is there an alternative way to do it? Is there something else more natural?
Absolutely, which is always the case. I'd like to touch upon whether at its extremes, the weakness that people see could actually be another condition. And there is a condition known as rhabdomyolysis, which would be a more extreme side effect, adverse reaction, really, which is complete muscle breakdown. Thankfully, it's rare compared to muscle weakness, but rhabdomyolysis would often hospitalize people, wouldn't it?
Oh, yeah, no, that's a fairly severe condition. Now, there are gradations to that. So, if you do a very, very intense workout, sometimes you'll see people that do a very, very aggressive workout or play a sport and they go get their labs, and you will see an enzyme called creatine kinase that's elevated, which is what we look for with rhabdomyolysis. So that can happen, and you can have a mild kind of increase in this. The problem is the rhabdomyolysis that's caused by statins can be fairly mild, but the thing that's causing it won't go away because you're taking it every day. And so it can build up and get worse, worse, worse. The real problem is you're breaking down the muscle, and these proteins and this enzyme, everything, it's being filtered through your kidneys, which do not like this one bit, and it'll start to do damage to your kidneys. So that is how that condition works and why it can be so dangerous.
Yeah, I mean, essentially you're having massive muscle breakdown, right, of skeletal muscle and all that, the protein and everything that's being released really just clogs the kidneys. And I think that's really standard of care if you're on a statin, that people really should make sure, because I don't see this actually very often. I'm glad you brought it up, Ben, actually, is total creatine kinase, because there's side effects and then there's adverse effects. And you need to make sure, if you're not checking that, that myalgia or muscle ache actually may be extreme muscle inflammation, which can lead to really massive muscle breakdown. And that's a really differentiating biomarker to be checked. I think every time you have your blood work done to check.
Yeah, absolutely. Creatine kinase is a blood test, which leads on to the next important blood test and potential adverse event, and that is elevated liver function tests. I've seen this a fair number of times. What we call the transaminases, the AST, ALT, will be elevated in people who've been on statins. And often I personally advise somebody who's been started on a statin in the hospital to get their LFTs checked after a few weeks. Would you like to speak more about that as well?
Yeah, I mean, it's just routine. We know that statins affect the liver, and that's why we check it. We know that cholesterol is produced through the liver, and so it's this inflammation in the liver caused by statins. Lots of people won't get it, but you don't want to miss it. And again, having routine blood work and these, this class of medications really actually needs to be followed with routine things like liver function tests.
And, the inflammation that's occurring from this medication, it is causing irritation and inflammation of the liver, which is in theory reversible. So if you stop the medication, those enzymes should come down and the inflammation should go down. However, if you're doing this for a very prolonged time and the liver enzymes are up for a long time, which means there's a lot of inflammation, there can be permanent effects from this. So it's not a minor side effect. It's something you absolutely need to know about and deal with.
Yeah, I think that actually is often really downplayed, and that is side effect, because it is rare, but when you see a case of it, you never forget it. I think, especially as a physician prescribed medication, we never want to harm anyone, and it's really can be really devastating and life threatening in people.
Exactly. I always like to say that nothing is rare to the person who suffers it. I've seen many people have elevated LFTs due to statin medications. Usually we have to obviously stop the medication. Okay, I'd like to talk next about an adverse event potentially for which we're seeing more and more research, and it's close to my heart because I do a lot of research myself and make videos on the issue of cognitive decline. And I'm concerned with the research that I'm seeing with the link between long-term statin use, which of course now dished out like candy, and the potential for a link to cognitive decline and dementia, because the brain is 60% fat at the end of the day. And you have to remember that cholesterol is a vital part of cell membranes. And it doesn't take an Einstein to work out, no pun intended, Einstein and brain, but it doesn't take an Einstein to work out that if you're aggressive about this, there could be some adverse effects on the brain. Okay, everyone, I'm going to interrupt that tremendous discussion for a moment to tell you about our expanding health and well-being store. I'm very proud of our natural, uniquely formulated products. Check in the links down below. We've got our natural anti-inflammation immune support, bone support, memory support, heart support, and sleep support. Also, our newly released organic chai mix based on the tea that I regularly drink. We are made in the USA and very proud to be working with a veteran-owned company. Ohighwellness.com if you're in the USA, North America. Ohighwellness.co if you're in the UK, Europe. All right, back to the discussion.
I agree. I mean, we talk about older, people or just patients in general that are on this medication. Often we're told, or they're told it's brain fog, or, it's just, age appropriate. And a lot of times, these, statins deplete, LDL cholesterol. It's a very, core component of of sort of like the blanket that surrounds the brain cells.
Yeah, and so what you end up seeing is that the guidelines of how far to lower the cholesterol, where you want those numbers, don't take into account, how much cholesterol does the brain need to do its job, do what it's supposed to do. And if you're lowering cholesterol too aggressively, what's that going to do in the future? What's that going to do to your brain health? What's that going to do to the early development of cognitive issues and memory issues? So it's a great question. I think the research is questionable at this time. I mean, there's certainly a lot of research and studies coming out to look at this because it is concerning.
Yeah, absolutely. Really concerns me. And I really feel bad because I know that there are many older people who come into hospital, they'll suffer an event or the doctor will be very concerned about high cholesterol and they'll be put on these very high doses of statins and the doctors are all in, oh, let's be aggressive, lower the LDL less than 70. And I'm thinking, what is this doing to your brain? Where is the evidence? And especially at the extremes of age, these people were not even studied in the first place. It's ludicrous. And it makes me quite angry that the medical profession can just take on board what is told to them, often by drug companies, and not think for themselves.
It's become like really algorithmic in a sense where like, oh, you have this cholesterol, you need to be on this dose of statin. But, we didn't take into account that maybe that medication wasn't, studied in your age group and the potential risk benefit of it. I think the main thing is, cholesterol is not the enemy here. It's really like, inflammation, metabolic stress, is really things that should be attacked more with lifestyle improvements. So just throwing someone on a pill, right? I mean, it just doesn't make sense to me. It's actually, it's quite frustrating.
That's very true. So yes, cognitive decline, big concern. Okay, let's talk next about a potential link with diabetes mellitus type 2. Obviously, that is insulin resistance, but the question is, can the process of developing insulin resistance be accelerated by statins? And I have seen some evidence that insulin sensitivity can be impaired by statins.
Yeah, there is some evidence behind that as well. There are some studies coming out to address that. In my own practice, I've seen that where, we couldn't exactly say that the statin was the smoking gun, but I had much older individuals and their only risk factor was being on a statin and they developed diabetes late in life and their diet was good and they were exercising. So it was, there is clearly some link there. And it appears to be an impaired insulin sensitivity. So it is very interesting.
It is, yeah. And diabetes, of course, we know cases are soaring. So the last thing we want, in addition to people obviously not having an optimal diet, many people, is a medication which could increase the risk. All right. So next up, let's think other more generalized effects. GI complications. I mean, like with any medication, people can sometimes get gastrointestinal side effects. Have you seen that sometimes?
Oh, absolutely. Yeah. We've seen people that develop diarrhea that we can't get to stop, generalized GI discomfort, fatigue, just feeling unwell generally. So, you can see quite a few different side effects on this medication, but those are some of the bigger.
Yeah, it will just draw sort of a bigger picture of that. When you're starting a medication, you should really be educated on the side effects of it or adverse effects, really. And I know we're talking about statins. That really applies to all medications because you want that patient not to be dealing with something that they may think is not related to the medication at all. And again, it's going back to be your own advocate. I'm not feeling well after I take this medication, and they may say, well, it could be something else. And
Yeah, and people know their own bodies. You all know your own body. If you get prescribed something or a loved one gets prescribed something, and you say, well, this doesn't seem right after a few weeks, I've got this side effect. Usually 2 + 2 = 4 most of the time when a medication is prescribed. Okay, let's see some other potential side effects. Neuropathy, there is a link with that. I personally believe a lot of this comes back to the coenzyme Q10 issue,
Right.
because there's such a strong link with metabolic function. And if your metabolism isn't functioning optimally, you're going to get a lot of these effects. Neuropathy is definitely something that's documented.
that is so, there is a strong component of CoQ10 deficiency. And I think most people out there who are on a statin, when is the last time your doctor or physician has talked to you about coenzyme Q10 deficiency? It's often underdiagnosed. How do you treat that? I mean, I think that's another thing we probably haven't talked about is just, I do advise patients who have had muscle aches or not an adverse, but side effect is getting a good quality, supplement like CoQ10, that you can take that will replete that if you can tolerate it.
Yeah, absolutely. That's a very good idea for anybody out there who's on a statin. I'm sure everybody watching has family members. If not you, maybe you're not on a statin, but you will have family members. I know I have lots of family members who've been prescribed these drugs. And nothing we're saying here, of course, applies to everybody. Maybe there's people who've taken statins and have had no issues whatsoever, but we've seen enough of these side effects to really want to make this video. Okay, so let's summarize then in our closing statements. I will say this, statins are basically a multi-billion-dollar drug industry. We're going to talk again about the efficacy of statins and some very questionable evidence. But in terms of side effects, I have seen many, many people who have suffered with an array of side effects. Everything that we've mentioned, I have seen, and it's usually started quite quickly. And where I feel particularly bad is I see a lot of people over the age of 70 prescribed high doses of statins with often very weak evidence behind why they're being started. And then they've had side effects. Most commonly, it's been the weakness issue, feeling weak, having muscle aches. And doctors usually, if a patient is really suffering, should really stop that medication, not even decrease the dose, especially at that age.
I totally agree. And I think one of the biggest problems with statins is it's a failure to look at the patient as a whole and to say, hey, there's something going on metabolically here where your cholesterol is very high, your A1C is very high. There are a number of markers that are not consistent with, good health. So I'm going to put you on a pill instead of saying, hey, we got to make some real changes here and work with them closely to do that. I think statins, like many things we talk about in the current medical industry, are one of those quick fixes because the numbers come down quick and everybody feels good, but have you solved the problem? And I think that's the big question.
Absolutely.
And I couldn't agree more with that, Ben. And I think your physician treating you needs to look at the bigger picture. And there's other tools that are probably underutilized in putting a patient on a statin. It's much easier for a doctor just to write the script, but other tools like checking CRP levels or inflammatory markers, which heart disease is an inflammatory process. Cardiac calcium scores are often underutilized. So if you have high cholesterol, get a cardiac calcium score. If it's 0, then do you really need to be on that statin? And I think really what I want to drive home is don't fall into that polypharmacy trap where like you're on a statin, you get muscle aches, and then no one diagnoses that it's statin-induced, and then you're on a pain medication, and now you can't sleep because you're in a lot of pain. Then you're on maybe something to help you sleep, and then next, it causes depression. I mean, this is just some old cycle of polypharmacy that we are really like against.
Absolutely. Yeah, it's a big, big problem. And the question is, I mean, these medications are dished out like absolute candy. Tens of millions of people on these meds over the last few decades have been sold that, we fix a number, you're going to do better. But yet it's a bit strange that heart disease rates are climbing. People are getting sicker, and now life expectancy is coming down. So it makes me wonder, when on earth is the medical establishment made to take a step back and say, what are we doing here? Everything statistics are getting worse. We're prescribing more medicines. So at what point do you say the medicines are not working? We need to sort of reevaluate our approach.
Wholeheartedly agree.
Yep, hopefully that will happen. Well, thank you everyone for watching. We hope that was helpful. We are rooting for you all to succeed, whatever medications you're on. If you're on any medications or loved ones, we want the very best for you. We want you to achieve the best health naturally. And once more, do check in the links down below for our separate channel and also our natural supplement store. And that also does include our heart support supplement containing magnesium, coenzyme Q10, and hawthorn berry. All of those links down below. Take care, everyone, and we will speak to you very soon.